Aromatherapy is another thing that we use often. We actually have many nurses trained by our nurse practitioner, Aurora Campo, on the use of essential oils. And I bring this up because it takes so very little to enact a body response. And it engages the olfactory system, the sense of smell, which goes directly to that central command center, which mediates a sense of anxiety or relaxation, the limbic center, which you've already seen the area. In fact, very small trials have shown that individuals who have had essential oils infused don't actually have to detect the scent in order to have the sense of, in this case, relaxation, which is nice because not everybody loves the aroma of an essential oil, even if it's lavender. It's very hard to find studies which actually look at the central nervous response to an essential oil. It's hard to patent an essential oil and make any kind of commercial benefit from, so then it's hard to fund a study. But I was able to find a citation released this year looking at EEG reactions and neurotransmitter reactions to bergamot, which is found in English breakfast tea. It enhances a sense of Earl Grey, sorry, thank you. But it enhances a sense of relaxation. Many people, gravitate towards essential oils, and some practitioners who are not healthcare practitioners will encourage taking these things orally or applying them directly. I just like to say, as a person who studies botanical substances, these essential oils are highly concentrated. There have been adverse reports of convulsions, seizures, etc., even abortions. And you should be especially careful in infants and children because their absorption rate is much higher and they have a much smaller body mass. So I will always suggest if someone's using an essential oil to dilute it, 1 drop in a teaspoon of carrot oil, such as almond oil or olive oil, will suffice. These are the 4 essential oils that we commonly recommend to enhance relaxation. Lavender, ylang-ylang, rosemary, and bergamot. And moving on to acupuncture, probably this has the most body of knowledge of all the things that we put into the bucket of other in terms of integrative management. And now we know that there are many mechanisms by which acupuncture has its effectiveness, in this case in reducing pain. It interacts with activation of 3 and 4 muscle fibers. It inhibits the descending inhibitory pain system in the subcortical and brainstem modulating pathway. There's opioid enhancement. That's probably the most widely known. But there's also non-opioid mechanisms. Even in the sham studies where needles are placed, there are actually some neurotransmitter modulation. So that has probably muddied up the waters in terms of our being able to understand in terms of clinical trials if acupuncture is effective for pain management or any other ailment. It's really how we construct these sham trials. But from the 1997 consensus, this was a multidisciplinary committee which looked at all the evidence back then, which was quite a while ago. These are all the conditions for which they felt they had the most evidence in terms of trials and acupuncture. Myofascial pain, osteoarthritis, low back pain, headache, menstrual cramps, tennis elbow, fibromyalgia, carpal tunnel syndrome, addiction, stroke rehabilitation, and asthma. There are some very nice reviews looking at all the acupuncture analgesia in clinical trials, and it seems to be consistent with the 1997 consensus. It is fairly effective. Although looking at every ailment and the number of trials, you will see very consistently that sometimes you'll have some trials with very statistically significant positive benefits and some which have, in the broader view, no relevance. And I think it's because when you put together all of these trials, the way they construct their placebo arms, the way they construct their sham acupuncture arms, they often will have needling. And as I suggested just a couple of minutes ago, just merely placing the needles in the skin, not on the acupuncture points, will actually change some of these neurotransmitters like the diethyl, I can't say it correctly, but the diencephalon system. So what does that mean for us? I think it means that we have to know our acupuncturists well. We have to, it is a bit of a trial and error, and I think, but we do have the luxury of having some randomized trials that suggest there's positive benefit. Here's another research article suggesting that slow breathing can help reduce pain. I have taught breath exercises to many patients. It takes about 15 seconds. And basically what's happening is you're engaging a patient to use their breathing, and this is deep breathing. In other words, relaxing the abdomen, and when you take a breath, having that also get released, as much as just doing the chest breathing. You're engaging the parasympathetic nervous system and enhancing the relaxation response. Meditation is another form that we often use. There are so many types of meditation. There's meditation just paying attention to your breath. There's a very structured program of mindfulness-based stress reduction meditation, which is an 8-week course that we offer at the center, and I think we also offer at Beth Israel as well. This has been shown in a recently released study to benefit those who had pain in the sense of their perception of how things were for them, and as well as the somatic aspects of it. Here's another research article performed at the University of Penn on early Alzheimer's patients, teaching them what's known as Kirtan Kriya Yoga. That is a singing kind of meditation. These individuals did this for 12 minutes for 3 months, and their cognitive scores actually improved after this intervention. Here's a breath exercise that I share regularly with patients. Basically, it's breathing in through a count of 4 through your nose, breathing out through your mouth to a count of 5, doing 4 breaths in the morning, 4 breaths in the evening, or any time you're in a stressed environment. I can't tell you how many times patients have found this to be very successful. We actually share this in the fellowship, the Integrative Medicine Fellowship at the center. And we had one of the learners who was an attending at the addiction center. She actually taught this breath to people who were on methadone. And lo and behold, these patients came back. This was a real shock to her as well as it was to us. These patients who were on methadone, who were having really troubled lives, people really do have a lot to deal with, who were amazed at the power of enhancing their sense of fulfillment and reducing anxiety. And here are people on fairly hefty pharmaceuticals for addiction. So this seems so innocuous as a suggestion clinically, but you should try it. It's really very easy to do and doesn't take up a lot of time.